I am a consultant hematologist. I specialize in the diagnosis and treatment of blood and bone marrow disorders. The aim of this short film is to provide some basic information about chronic lymphocytic leukemia, or in short, CLL, for the newly diagnosed patients. A new diagnosis can be overwhelming, and the patients tend to miss the basic facts given to them during the first consultation. This short film will hopefully give you the core facts about what CLL is, the symptoms and signs associated with CLL, tests and investigations required for the diagnosis and staging of CLL, the treatment options available for CLL, and briefly about living with CLL in general. I hope that following the explanation of these crucial points, you will be empowered with a better understanding of CLL. This, together with a strong relationship between you and your hematology team, will make things clearer to you and your loved ones. Chronic lymphocytic leukemia is a slowly progressing disease where the bone marrow produces too many of a certain type of white cell called B lymphocytes. The word leukemia is derived from Latin, meaning too many white cells in the circulation. There are many types of leukemias, and not all types have a poor prognosis. In fact, chronic lymphocytic leukemia is a slowly progressing disease, and many patients have no symptoms for years. That is why, in some patients, CLL may only be discovered by chance when a patient goes for a routine blood test. As I have already mentioned, CLL is a disorder of the bone marrow. Bone marrow is the factory that makes various blood cells. For example, it makes red cells which carry oxygen, platelets which help with clotting, and various types of white cells which work as a defense force for the body, fighting infections. There are various types of white cells, and one of the subtypes is called B lymphocytes. CLL is a disease where the bone marrow produces too many of these B lymphocytes. The excessive production of these cells will begin to crowd the bone marrow and eventually spill over into the circulation, where they are detected as a high lymphocyte count on a blood test. B lymphocytes are also found in normal lymph glands. Therefore, excessive production of B lymphocytes can cause some of these lymph glands to swell up, as these cells go and reside in patients' lymph nodes. This can lead to enlargement of the lymph nodes. In fact, it is not uncommon to find some degree of enlargement of lymph nodes in patients with CLL. In some cases, the abnormal B lymphocytes mainly reside in the lymph nodes rather than in the circulation. Such patients may have prominently enlarged lymph glands, and the disease is referred to as small lymphocytic lymphoma, or SLL. In principle, it is the same disease but with a different presentation. As mentioned earlier, most cases will be without any symptoms during the early phase of the disease, and this may be the case for many years. More advanced disease is associated with expansion of the B lymphocytes in the bone marrow, which will interfere with the growth of other cell lines, and the patient may present with anemia, which will cause some tiredness, or may have increased infections due to the weakness of the immune system. And there may be bleeding tendency if the platelet numbers are low. The patient may also develop enlarged lymph glands. B lymphocytes are also capable of making abnormal antibodies, which may lead to the destruction of patients' own red cells, causing anemia, or patients' own platelets, which will result in a bleeding tendency. These sort of complications are referred to as immune complications of CLL. Patients with disease progression or advanced disease may have symptoms like night sweats, fever, or weight loss. These symptoms are referred to as B symptoms and often are an indication for the need for reassessment of the disease by your hematologist. Similarly, a rapid increase in the size of swollen lymph glands is an indication that the disease may have become more aggressive and that treatment may be needed. The diagnosis is usually suspected following the discovery of a high lymphocyte count on the full blood count test. This, however, requires further confirmation by means of more precise lymphocyte typing tests like the cell marker studies on the blood sample. The full blood count will also give us an idea of the hemoglobin and platelet count. If the hemoglobin or platelets are low, it may be a sign of advanced disease, and that patient may require some additional tests. Further investigations may be considered when disease progression or advanced disease is suspected. This process will include a bone marrow biopsy with the aim to check the lymphocyte burden in the bone marrow. A CT scan will also be done to assess the extent of lymph node enlargement caused by the disease. It is important to note that CLL is not a curable disease. It is, however, a very controllable disease, and there are various treatment options and regimens available for this purpose. As there are a number of effective treatment options, it is possible to tailor the treatment to the patient's needs and the ability to tolerate chemotherapy. Although technically there is no complete cure for this condition, most of the current treatments are very effective in providing medium to long-term control of the disease. Treatment, however, is only required for the advanced stages of the disease. Most patients with CLL do not have symptoms and can enjoy normal day-to-day lives. The disease, however, should be monitored at regular intervals with the help of full blood counts. The disease may remain stable for long periods of time. If the blood counts show signs of progression or you develop any symptoms of advanced disease, then you should contact your specialist who will arrange further assessment of your disease. Remember, CLL is a slowly progressive disease in majority of patients, and it may be many years before you require any treatment. Moreover, the treatment of CLL is being revolutionized by some of the new tablets now available, which are greatly improving the outlook of this disease.